Today we learn something about snoring. Snoring is a very common problem in the society and sometimes it leads to matrimonial discordance. Channel's name is Heartbeat. My name is Dr. Amit Kejriwal. Definition. It's a hoarse or hushed sound that comes from mouth or nose that occurs when breathing is partially obstructed during sleep. So, this is sound which is of hoarse or harsh quality, can be sometimes like whistling sound or the hooting of an owl when the nose is partially obstructed during sleep. There are various causes: nasal congestion and cold, anatomical variation of nose or soft palate, alcohol consumption, sleep deprivation, allergies, overweight, age, and later stages of pregnancy. So these are the common causes for snoring. So if you have a snoring, when do you visit a doctor? When you have documented breathing pauses during sleep, excessive daytime drowsiness, difficulty in concentration, headaches in morning, sore throat in morning, restless sleep, gasping or choking in sleep. Apart from this, if you have the patient has high blood pressure, chest pain at night, or disrupting partner's sleep, you still can visit a doctor. Various risk factors. Males are greater affected than females. Age. So as the age increases, the chances of snoring increases. These two are basically irreversible. Overweight. This can be controlled. Narrow airway. Alcohol consumption, another risk factor which can be controlled. Nasal problems. Family history of snoring or obstructive sleep apnea. You can develop a variety of complications. Some of them are quite common and threatening. Daytime drowsiness, irritability, difficulty in concentration, higher risk of blood pressure and heart problems, and higher risk of paralysis attacks. So these are the various complications of snoring. Approach. So all medical checkups require history, clinical examination, and investigation. So when you go to the doctor, he'll do the history and he'll do the clinical examination. He might ask a variety of things in the history. He may examine various parts of the body and he'll ask for some investigations. The investigations generally asked are like X-ray of the nasal area, CT scan, MRI, and they may do sleep studies, look at brain waves, blood oxygen level, heart rate, breathing rate, sleeping stages, eyes and leg movements. So in sleep studies you see all these 6 parameters. Non-medical management of snoring. So you can lose weight, avoid alcohol, smoking, or taking sedatives at bedtime. Treat the nasal congestion. Either you can take steam inhalation or you can use nasal decongestants. Avoid sleep deprivation. Sleeping on one side may sometimes help. Adequate sleep 7 hours per night. You can raise the head end of bed by 10 to 15 centimeters. So this may just help. And to prevent the allergies, change your pillow or clean your fan periodically. Medical treatment. Well then, treat the allergies. There are a variety of oral appliances that can be used. You can use a continuous positive airway pressure. or there's upper airway surgery for narrow airways or deformed anatomical lesions. So we've seen the basic treatment guidelines for snoring. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.